I love you.
Welcome
My
to the
favorite
channel.
is Maggie. Scoop Show is what I'm about
To the
actually.
channel. Welcome to the channel. We've talked a lot about the cancer thing. The cancer thing. We were talking about something that is called something that is called something that is called something that is called breast cancer. When we talk about cancer, we have different type of cancers, and we talked about how cancer starts and where it comes from. You see, and where it comes from, and we say cancer starts from the cellular part. Cancer starts from the cellular part, and it is a very important point to note that yes, someone is telling me that is not seeing me. Okay, it's very important to note that issues concerning cancer, they start from mostly genetic issues. They start from mostly genetic issues, and mutation occurs. So when mutation occurs from a cell or several cells, this is where you get some problems. This is where you get some problems like I give this a link. This is where you problems starting from the mutations, starting from the issues that everyone gets. Cancer is something that can be contained. When we talked about several things that cancer brings to a person, you saw that cancer can be contained in specific ways. In specific ways, you see, like if it is starting from the cellular part, if it is starting from the cellular part, before it advances to go and destroy and disturb other cells, this is where we can contain the cancer. This is where we can contain the cancer. You see, it is very important to note that cancer issues are contained at an early stage. At an early stage. If you wait and you're waiting for so long so that you can manage your cancer, it will have several problems, and these several problems can bring so much complications. They can bring so much complications. So with this today's topic, we are going to base on how we can manage cancer cells, So if you are new in the platform, please hit the like button. Don't forget to subscribe to my channel. It may be helpful one day. You see, we are talking about how to contain cancer, how to make cancer not to go to the next step. So it is very important in the life of a person. Maybe you've in contact with a person who has cancer, you've been near a person who has suffered cancer, you've been near a person who has had these cells in their bodies. Today, I'm going to discuss on how you can help this person, the cancer not to go to an advanced stage, because cancer goes to the advanced stage when cancer. Dr. Benjamin going out now, but I'll be still in the background. Thank you so much. Sorry, Dr. Benjamin, I don't know why I can't get in on the computer. Okay, you just follow the link. You go to my channel and hit my profile picture. It will show you. That is for Jamaican Uncle. Go to my channel on the computer. You will see the profile picture saying I'm live. Then you hit the live. You will go straight to where this link is going, or you follow that. You send that link I've sent you to WhatsApp through, and you will be okay. So today we are talking about management of breast cancer according to the stages that we did. If you didn't see the previous stages, it's important you go behind back and see the previous stages. If you have a question, concerning cancer, please don't hesitate to ask any question concerning cancer. If you have any question concerning cancer, if you have any question, any medical question, or concerning any medical thing, don't fail to ask. It is an open forum. We can discuss. The people that are in the chat, you can interact with them. We can ask questions. This is an open forum. It is an open forum. So today's topic is how can we manage breast cancer? How can we treat cancer according to staging. Most of the cancer patients are in pain at advanced stages. If you are new today, please don't fail to subscribe to the channel. You know, if you subscribe, maybe one day you're gonna want to know about something and you remember, oh, Benjamin the Wise Guy's channel talks about these problems. Here we talk about medical problems. So when you remember that I talk about medical problems, you come and check which one you want to know. We talk even about mental health issues here. And today evening, don't forget, we have the Feel Good Evening Day where we jump up some reggae vibes, we interact, we do some good things at 9 p.m. Kenyan time, at 9 p.m. Kenyan time. So if you are there and you want to jump up to some jams, reggae music, as we talk about mental health, don't forget to join Benjamin the Wise Guy at 9 p.m. It is a bomb. You'll meet there so many people that are blessed and they do good things. So if you are new, please don't forget to hit that subscription. As Savior Man says, even the big YouTubers, they ask for subscription. Promote the page by subscribing. So cancer, we talked about cancer, and we first thing when it comes to knowing if you have breast cancer, checking your breast. Once in a time when taking a bath, when you are out there doing your thing, don't forget to palpate your chest to see if you have the breast cells, cancer cells. Palpate your J-Hank. Hi guys, welcome to the channel. Everyone that is here, Savior Man, Jamaican Uncle, and those that have not. If you are here, say something to the chat. We know that you are here. If you are listening, please go to the chat. Hit there, say something to the chat. We know that you are here. Don't just be silent, man. Don't just watch. Let them people know that you are in the chat. Let them people know that you are available. The chat is open, questions are open, and my people are there. They are always there to take care of the new guys that are coming in and those that need help. Now, we talk about this important thing that is called good to see you, Doc. Welcome, Hank 47, J Hank 47. Welcome. Thanks so much. If anyone has not hit the like button, please, it's open. Mavia V, what you eat matters. In the environment around us, we are exposed to a lot, even in good food. Yes, we are exposed to a lot. And Mavia, you are very right. Hi everyone. Mavia, welcome to the chat. Welcome to the platform. We talked about how cancer comes and what the things you eat and the things you expose yourself to. So if you didn't watch those videos and interactions, you are open. My playlist of game is open. You can go there and watch those videos and get to know more about cancer. So management of breast cancer, a very important topic. First of all, is you have to identify there is a problem. First of all, you have to identify there is a problem. And the identification of there is a problem starts from you yourself. By when you're getting to the bathroom, when you are having your good times with your person, you palpate your breast and then you feel some hard nodes inside. That is the first step of management. Don't wait. If you're palpating your breast and then you feel anything hard inside, don't wait. That will be the first step of management. The first step of management of breast cancer is identification of the nodes. It may be 1, or it may be several. You get it? It may be one or it may be several. So when you've palpated and you feel that this breast of mine, or if you are a man, you feel at your chest you have something that is like a node, you go ask a doctor what might be the problem. Because I'm palpating my breast and I'm feeling like there is a node inside. The doctor himself or herself will take a second step of examination of your node that you're feeling. Then the doctor will say, no, this is an invasive and it is irregular and it feels like it's a cancerous node. You see, manage from you yourself. Don't ignore nodes that you feel in your breast. Don't ignore. You get? So when you have identified them, you go to a doctor. A doctor does his examination. After a doctor does his examination, what next? He stages the cancer cells. He stages the cancer cells by doing whatever we talked about yesterday. So you do let me get Mavia away from mammogram. What other tests would you recommend for breast cancer check? Mavia V, we talked about it yesterday. It's in the video of yesterday, but there are several tests. There is a biopsy that you can do. There is this protein check, immunoidentifiers. They are called immunoidentifiers. Right? The immunoidentifiers. I know some people remember them. Let me put it here. Well, these ones are called immunoidentifiers, the ones that we discussed yesterday. So after you've got to the laboratory and you've run the immunoidentifiers, the human epidermal growth factor, you've run the estrogen factor and progesterone factors, you categorize. Baby Shosh is here. Welcome, Baby Shosh. Hi, long time. Hope everything is okay. Wow. Fine. So if you have run immunoidentifiers, you categorize the cancer. Please, if you have not watched yesterday's video about how to categorize the cancer, please go and watch. After categorizing, if it is luminal A, luminal B, HER2 enriched, or triple negative, that is where you just, it's okay, son. Hello, doctor. Nice. When you have categorized it, now you stage. You stage there. So Mavia 3070 is asking the tests that we can do. There are so many tests. The tests depend on how the patient is. If it is a small nodule, and when you touch at the axillary point, you are seeing no node is inflamed, it's just localized. That is a sign that this, Marjay, welcome to the platform, Marjay. Thanks for tuning in. You examine, you feel the breast has a node inside, and then this breast, there is no metastasis. If you look at the axillary nodes here, they are not swollen, they are just there normally. You have to think that this is always stage 0 or stage 2. You get? Stage 0 means there is a node, but there is no metastasis. It is just a node that is non-painful, and it's there a small, less than 2 centimeters. So when we go to stage 2 is whereby we get, you have, when you're palpating, you have the node, and it is there, and it is less than 1 to 1.5 centimeters, but it has not exceeded 2 centimeters or 2.5 centimeters, and there is no metastasis. Metastasis means going to the nearby nodes. is whereby you find it is between 2 centimeters to 5 centimeters node, and it has gone to the next lymph node here. So the tests depend with what your findings are. If you didn't watch yesterday's live as we discussed about breast cancer staging, please go and find out about it. It will be so helpful, but I'm just giving an overview. So when you have gone to hospital, your doctor will do some tests. Your doctor will do some full hemograms to check how your blood is, a HB level, some white blood cells like basophils, mesophils, and lymphocytes. You remember lymphocytes we have T lymphocytes, B lymphocytes, and then we have NK cells, natural killer cells. B lymphocytes, when it comes to matters a histamine reaction. Onik, welcome to the platform. Onik, thank you so much, my good moderator here. Welcome to the platform. Now, he'll check all those when it comes to full hemogram, and then he will stage. You can do something called CRP for checking the C-reactive protein. You can do erythrocyte sedimentation rate to check a category of infection that you have. As a person who is suffering from breast cancer. There are some things that I'm cool. Onyx. Today I want you at the feel good evening, 9 Kenyan time. It will be a bomb. 9 Kenyan time. 9 Kenyan time, 9 p.m. Kenyan time. Find out your time where you are, Onik, what time it will be. We have something big at 9 Kenyan time. Don't forget to subscribe. Thank you so much. Yes, don't forget to subscribe. So when they have categorized the cancer, the breast node that you are having, when the doctor has categorized and has said this one is stage 0, then we start managing it as according to 1745 time America. Yes, that time it will be a bomb. We are doing something called feel good evening, and it will be a bomb. Onik, I know I want you there. I know why I want you there. Even everyone is invited at 9 today. Feel Good Friday, when we talk about mental health. You come and see what we do there and enjoy. Come with your playlist of music. Armenia, okay. Armenia, okay. So we continue with our breast now. Management of breast cancer depends heavily on stage and diagnosis, which reflects how far the cancer has spread and how far the damage it has done. Don't forget to like the right stream, of course. Yes, only. So let them people not forget to like the live stream. Now, there is something called stage 0. Stage 0 means ductal carcinoma in situ. Carcinoma, you have the cancer that has mutated. You have the cancer, this is inside the breast. This is non-invasive cancer, has not spread beyond the duct. It is you have a node that is less than 2 centimeters, but the node has not spread towards the duct. If you do something called an ultrasound, you'll see it is just something that is there. A small node that has not spread towards the duct node. Ductus node is the node, the mammary glands, the ducts, the mammary ducts that produce milk. So you will find that it has not spread more than there. Yes. And we have something called mammogram, which Queen CNLB in the team. Welcome, blessing team from Rochester, New York. Happy Friday. Queen CNLB, thank you for being at Jamaican Uncle yesterday. You did an amazing work and amazing show. I was there, but it was so late, I had to go and rest. Thank you so much, ma'am, for your amazing job that you are doing, and even mentoring us spiritually. I thank you for that. I thank you for everything that you are doing. Now we are managing breast cancer according to stages, because we cannot manage breast cancer without staging. You cannot manage breast cancer without staging. It will be hectic. So the first thing you need to do is to stage. And we saw yesterday how you can stage breast cancer. It is very important to know how you can stage breast cancer. It's very important. So we staged it yesterday. You can go through the, you can see luminol A, luminol B. You can check on how we stage them. After staging, we do immunomarkers here, our immunomarkers here, we see. After immunomarkers, now we will start knowing what to do. Because now I've said here, stage zero, this is non-invasive, has not gone beyond the breast ducts. The breast ducts are the fatty layers and the ducts that produce milk. It is inside, but it has not gone beyond those ducts. You get? This one, management for it, surgery, conservative management, lumpectomy or mastectomy. So it depends with how it is, the surgery. It is stage zero, but here you cannot remove the whole breast. No, the lump itself. You are at a position to remove the lump itself. Because now it has not spread. If you remove the lump, so mostly if you remove the lump, it will not spread. But some people always say, once you remove the lump, it is important to do something called radiotherapy to kill around the cells that are there, so that if there is any cell that has anything, concerning mutation or so, it dies. You get, it dies. There is something called radiotherapy. Usually after lumpectomy, you remove and then you do radio. Radio means you burn those cells that are around the lump that you've removed. Let me check if I can demonstrate something. I can demonstrate something. It's important sometimes to understand. I'm talking at the first stage. You have said the first management of breast cancer is staging. The first management of breast cancer is staging. So I'm drawing a breast here and some lumps, some mammary glands. So we are at stage zero, and stage zero, the duct has not gone beyond. It has not gone beyond the duct. So the ducts are here, the ducts, and then we have a lump here. So this is your breast. So these ones are the lumps. So you have the node somewhere here. The red thing, let's see, the red thing might be the red thing here indicates the node, the cancer. It has not spread, maybe it's benign. Now after removal of the node here, it has not spread. You see, it has not spread. You have to burn this place by radio waves, because when you cut and remove this, lump out of your breast, what you are doing is you are causing a wound, and when you are causing a wound, you can cause that wound to have the problem that the node had, the cells there to mutate. Guys, if you are new here, please subscribe. We are talking about how to treat breast cancer. If you are new, please subscribe. Don't forget to subscribe, and don't forget to check out the people that are in the chat. Say something, text something, say hi, interact with the people that are in the chat. Like, double tap your screen, my friends. If you are new, let's learn about curing breast cancer. Now we have cut, and this is a wound. You know, when you have a wound, it is easy for those cells that are around there to mutate. So what we usually do is we do radiotherapy, usually after lumpectomy. This is called lumpectomy, lump removal, lumpectomy. Lumpectomy, removal of the lump. It is called lumpectomy. You get it? So when you have removed the lump, you have to do radiotherapy, so that those cells that are there, the cells that are around there, can die. They don't start to go. Hormone therapy, we give some drugs like hormonal therapy like tamoxifen. Why? If ER and PR is positive, if estrogen receptor hormone is high and progesterone receptor hormone is high, and you remember that one is luminol A. That is luminol A. That's why I say carcinoma stage 0, that one is luminol A. Most of it doesn't have human epidermal growth factor 2. It is treated so well. So when you remove that lump, do a radiotherapy. If you check these things out, the markers, and then you see ER and PR is positive, estrogen is positive, and progesterone is positive receptor, you give tamoxifen. So that tamoxifen will prevent progression to invasive cancer. Hey, Marcia Thompson, how are you going on? Hope you are doing fine. So good. Okay, so prevention of cancer is very important. Prevention of cancer at stage 0 is very important. If your immunity is low, like maybe we did a full hemogram, complete blood count, and you saw your hemoglobin is down, those are additives. We will give you some blood boosters. If we check your white blood cells, we see that the lymphocytes, the T lymphocytes, the B lymphocytes, and NK natural killer cells are low. We will give you something to boost their regeneration so that you have good immunity, and advise you on nutrition. So stage 0, we don't have so much to talk about when it comes to breast cancer. That's why I'm usually telling people, always palpate your breast, always palpate your breast. If genetically in your family you have a problem of the genetic gene that we said, breast cancer. Hello Kingwe, hello, welcome to the platform. We are still at management at stage 0. If in your family you have that problem and you lack something called breast cancer gene 1, the one that repairs your DNA. You know, some people are born with no breast cancer gene 1 gene that repairs the DNA. This makes them prone to having problems when it comes to cancers of breast. It makes you susceptible. Anything you can do, the food you eat, alcohol, smoking can make you get the cancer. So you be checking yourself once, mostly when you are family line, you know there is someone who had this thing. Even men, it's important. And men, women pass their characteristics to sons. So if you are a man and the side your mom or your auntie had some breast cancer, always be checking out these lumps in on your chest. They can come and you can get it's a breast cancer. Mostly when your estrogen is high. So we have said that lumpectomy, this is not a complicated stage, and most patients at stage 0, they heal. Your hormone test, hormone imbalance can trigger hormone deficiency or estrogen dominance. Yes. Personal hormone test, that is for MAV 3070. Personal hormone balance is very important, mostly for women. So when you have hormonal imbalance, and mostly we see that your estrogen has gone up, and then it ignites something called estrogen receptor protein gene to be positive, and then it ignites progesterone receptor positive, and your family, you are born with breast cancer gene 1 insufficiency, you are prone to have this problem. You are prone to have breast cancer. So you need to know more about yourself so that you, Efasi Lipenga, hello Benjamin, the wise guy, and everyone watching. Welcome Efasi, my sister. Today we are managing breast cancer. You are prone to them, so it is good if in your family 1 or 2 persons survived breast cancer. You check these hormones and you check the genetic immunotyping, the human epidermal growth factor. You check the estrogen receptor and progesterone receptor, so that you can avoid You start avoiding earlier things that can lead you to have breast cancer. It starts with you. It starts with you. So we continue as we continue to like those that are coming. If you are continuing to like, I am Benjamin the Wise Guy. I'm Dr. Ben, and the channel is called Benjamin the Wise Guy. All the people that are in the chat, they are my community. If you are going there, of course, you like, and subscribe if you are a new person. Here we ask random questions, any question. Even if it is out of the topic, we ask any random question. So, stage 1 you have seen, very simple. It is carcinoma in situ. It is carcinoma in situ. It has not spread to the ducts. It has not spread to the ducts. It's just there. So, lumpectomy, the word lumpectomy means, I can see Simple Kate, we are discussing breast cancer management, and be open, anyone, be open to ask any question, because management starts with you and me. And you have said the first, it's good to hear you mention progesterone, because most of the time it is only estrogen spoken of. Progesterone is very important too. Yes, Mavia V, it's very important. You see, at the markers of breast, we have something called progesterone receptor, which makes your breast to align itself as per the breast is supposed to be. If you don't have progesterone receptor, you'll have so many problems. But if it is a lot, it can cause problems. So we should have a balance. So the stage 0, we have said the most important part is we can remove the lump, and then, or mastectomy, or remove a mass, and then we do radiotherapy so that we ensure those cells cannot. Yes, Simple Kate, I just subscribed to you. Jamaican uncle, I see you. Fine. Jamaican uncle, you have an egg from Simple Kate. Just right about now. Now we see hormone imbalance, hormonal therapy is very important, like tamoxifen, prevention of progress. These are drugs that limit the work of these two, estrogen receptor and progesterone receptor. They limit them so that they cannot cells continue inversely continuing to grow, and their cancer cells. You get, if these ones, they are estrogen receptor and progesterone works in differentiation of the cell. Estrogen receptor works with the gene of the estrogen to make your cells of your breast to multiply, and as the others die, you multiply and they continue. You see, okay, let's continue. Now, if anyone with any question on stage 0, is anyone having any question with stage 0? I think stage 0 is a very straight one. You are in the bathroom washing yourself, feeling good, yes, or you are with your person hugging, and the person is holding you like this, and your person feels a lump. He tells you, hey, you have a lump. You go to a doctor, he sees that it's less than 2 centimeters, and it's small, and it has not gone through the lumps and the others. So it just advises you, this one we will remove, do 1 or 2 radiotherapies, and then you use tamoxifen if immunomarkers are positive. That is stage 0. But we go to any person with stage 0 question. If you have a question with stage 0, please raise it. But if you are new here, we have a lot of yesterday we did about how to stage and what these immunomarkers are. We have Lumina A, Lumina B, HER2 enriched, and we have triple negative. You get? So stage 1, now we are from stage 0. Maybe you are feeling it, and you are not in a hurry to go to a doctor. So what do you do at stage 1? Stage 1, we saw it is less than 2 centimeters in place. When a doctor looks at it or does an ultrasound and count, do you have specific doctors you can refer? Because sometimes you get a wrong diagnosis. Yes, Simple Kate, I have doctors all over the world. Just tell me which country you are in. Me, I'm in Kenya here in Africa. I work with several doctors, and outside there I have doctors. So when you just tell me I have this complication or this, or if you have your personal doctor, we talk to the doctors. So if you are in Kenya, linking up is a good thing because I'm in Kenya. So we go to stage one. Now you kept on ignoring. If you are new person in the chat, please guys like the topic if you feel it's progressing on well and it is helpful, and subscribe to the channel. Don't forget to subscribe. Some things might be helpful at some point. You see, some things are helpful at some point. You may not have it right now, but in future you may remember Benjamin the wise guy, and you may come back to seek some information from this channel that you are watching. Now we see we have tumors that are less than 2 centimeters. Now this is a stage 1. You have no lymph node, because we saw the next lymph node from your breast are them axillary lymph nodes. So it is equal to 2 centimeters. It is equal to 2 centimeters, but it is not involving the lymph node. I can see people are coming in. Please like and subscribe, my guys. Medical information is diverse and you may need it even after 10 years, and these videos will be here forever. So please like. Good topic, glad I found you. Thanks Simple Kate. Thanks Simple Kate. If you need my number, those moderators you see at the chat, they have my number and my email address. You can just ask any moderator and you will be given. Now we continue here. You know, you have kept on ignoring the lump here in your breast, and then it grows up to 2 centimeters, and then you go to the doctor. He has done all the tests that we have done. We have talked about. He has done all the tests that we have talked about. Now, it in stage 1, it has no involvement of the axillary lymph nodes, which tells us if the axillary lymph nodes are not involved, it means there is no metastasis. It has not spread, because we saw when it comes to the lymph node, they spread so fast. So lumpectomy plus sentinel lymph node biopsy. The most important management is find out if it is big, 2 centimeters. You find out if the lymph nodes are involved. If the lymph nodes are involved, by doing what? Getting a sample and taking it for biopsy. Biopsy will show if cancer cells have already reached the lymph node. So if the biopsy says that the cancer has not reached the lymph node, you can remove the breast, or if you can remove the lump according to where the cancer cells have reached. Because if it is stage 1, more than 2 centimeters, you have to check the mammary glands and the breast itself, how it has spread. So you do a mammogram, a biopsy, and ultrasound to see progression. So according to the progression, this is where you do what? You decide with your doctor, because now you have done sentinel biopsy to the lymph nodes and they are not affected. It's only the breast, but in the breast it's more than 2 centimeters. So you check to other breast cells. If you see the other breast cells are affected, but it has not gone to the lymph nodes, what you do is you remove the whole breast. Is called mastectomy. But if it is just affecting 2 centimeters plus some of the cells around, you see if it has just affected 2 centimeters, let's say this is 2 centimeters plus some of the cells around here, you have to cut now this part, cut this part, and do something called radiotherapy so that it cannot spread. from the wound that you've made. But if it has affected all the breast, it is 2 centimeters, but other cells here are affected, some parts, and it has not gone up to the axillary nodes, what you have to do is you have to remove the whole breast. You have to remove, because if you don't remove, it will go to the axillary nodes. It will go to the axillary node, and if it goes to the axillary node, what will happen is the whole body will be affected and organs. So it is very important when you are taking these steps slow by slow. You may not be a doctor, but you may help other person to know. Natecho the traveler, welcome to the platform. Welcome Natecho, I can see you there. We are talking about treatment of breast cancer and how to avoid. So one of the complicated issue when it comes to breast cancer, and this is what someone really asked. I don't know if Saviourman is still here. Saviourman, are you still around? Saviourman asked, why do you treat breast cancer? And Natecho, don't forget to like and tell your friend what we do here. It's important. It's important you tell your friend, come and listen to these good topics and good advice here. So you have to remember, when you are removing the breast, you are preventing the mutated cells from affecting and spreading to the next cells that may go. You get it? Because now once it has mutated, it will continue affecting and going on straight. Yes? Yes. Thanks Jamaican uncle. Thanks a lot for pinning my number. Uncle has pinned my number there for WhatsApp. Yes, for WhatsApp. I think let me. Yes. Uncle pin the other one of 24. This one getting me. This one getting me from that one will be a problem. Let me give this one. Benja. Sorry about that. Let me give Dana this one. Benja Okwesh at yahoo.com. The other number is better than this one. Plus 2540729736024. So if you want to reach me, Jamaican uncle had posted, but I've given you the number that we use, 0729. Okay, well, sorry for that. Plus 2540729736024. Now that is the number that we use. The second one, 0729 on WhatsApp. You do WhatsApp, and I will get it. No, you get. So it is important to note these steps so that the cancer cannot spread. The drugs that we give in cancer, they are called immunomoderatives. They make the cancer cells not to progress. It is not like bacterial problems where the drugs we give are bactericidal. They kill the bacteria. Here we moderate the progression. Here we moderate the progression of a cancer. You get me? You get me that? So be sure when a cancer on stage 1 has enlarged and it has progressed around and it has not affected the big part of the breast, you can remove the lump but do radiotherapy. You can remove the breast but do radiotherapy. So we call it lumpectomy, and then we do to the axillary nodes the biopsy to find out if the breasts are involved. So radiotherapy after breast conservative surgery is very important. And then we have the most important part, systemic therapy depending on receptor. So when you have done hormonal therapy, you have seen that making my time hell here. Making my time hell here. So we've said, when you have done all that is needed, and then you see human epidermal growth factor 2 is positive, or estrogen receptor, progesterone receptor factor 2 is positive, the immune, those ones are the ones which progresses the breast to have breast cancer. What you do, you start hormonal therapy. Yes, some people use tamoxifen, some people use something called trastuzumab. Trastuzumab are drugs of targeted therapy if HER2, this one, human epidermal growth, is high, and it's making the cancer cells to progress so much. It stops them from this gene to work so fast so that the cancer cannot continue progression. And we do chemotherapy in high-risk patients, and hormonal therapy in estrogen and progesterone. You get? So targeted therapy mostly is done to human epidermal growth factor 2 gene to stop, because this human epidermal factor 2 gene that people have in their body, it is the one which makes the cancer cells to spread faster if you have it at high level. So if you have it at high level, we do what? We reduce its progressing and progression slowly by giving something called trastuzumab. Those are drugs that we give. The goal at stage 1 and stage 0. Stage 0, the goal of stage 0 is to prevent from spread and cure. Stage 0 here, when we remove that mass there, our goal is you to get well and be okay without cancer. Here doctors worked for you to be okay and to be without cancer cells. You get? You to be okay without cancer, you are cancer free, you are cured. That is stage 0. Stage 1 also, if you are treated and you have started management and you are in stage 0, the goal in stage 1 and 0 is to cure. Listen so carefully. If you are a new person and you are watching, please welcome. I'm seeing some new people are watching, but they are Barbara. Oh, long time, Barbara. I missed you. I see you here. Welcome to the platform. Thanks so much for tuning in. Now, stage 0 and stage 1, the purpose of treatment is curing. You have breast cancer, but the purpose of treatment in stage 1 and 0 is curing. You get? People say that once you get cancer, you cannot be cured. If you have any other ideology about breast cancer, please give me. Tell me. But I'm going according to the stages. Stage 1 and 0, we have removed the lump. We have done mastectomy, the mass have been removed, and now we are doing radiotherapy. The radiotherapy is to make the cancer cells not to spread or to kill the other cancer cells. When you do a wound somewhere, some cells may mutate. So those cells that are living there that are mutated, we kill them by radio waves so that they cannot go to lymph nodes that are near. I said we prevent any cancer cell to spread to any lymph node, because lymph nodes like tonsil nodes, auricular nodes, and then we have the axillary nodes, we have renal nodes. Their purpose is to return the drainage of blood extra in the cells and in the other extra compartments, to return it to the veins so that it can go back to the systemic circulation. So you imagine if we just leave and then those cancer cells goes back to the circulation, and you know the circulation of lymph nodes is called lymphatic system. It is intercommunicating and connected. You imagine if you leave and then we leave the cells that are mutated to go. it will spread so fast to the body, and that's what we are preventing. So the goal of stage 0 and stage 1 in breast cancer is to cure, to make sure that there are no cancer cells, and to make sure that you are okay, you have not had any problem in future. So that is stage 0 and stage 1. And then we have stage 2. Stage 2, it means large tumor or limited node spread. It is a large tumor, 2 centimeters, let's say 3 to 5 centimeters. 3 to 5 centimeters. This is stage 2. We are treating breast cancer according to staging now. Because the first thing when it comes to breast cancer, you have to stage the breast cancer so that you can treat it appropriately. So we are in stage 2, tumor or limited spread. So when you check at the Bishop Barbara, oh, welcome. When you check at the breast, it has maybe 2 to 3 centimeters, and then limited spread at the mass. And it may even affect the lymph node. But maybe you are lucky. You went to the doctors earlier. And when you went to the doctor earlier, what happened? When you went to the doctors earlier, what happened is one lymph node was starting to be affected. So when they did a biopsy at the lymph node of the axillary node, they found that one lymph node has started being affected by a mutating cell. So what they do is we do lumpectomy or mastectomy. We remove according to where the lump is, So when you remove the lump or you remove the mastectomy, the mass, often given before surgery, chemotherapy is given first. At stage 2, we don't remove, then we do chemo. No. We give chemo first to suppress the cancer cells that are spreading to the lump. Lump node dissection is important because now we want to find out if the lump is affected. You dissect, you remove a sample. One of our friends here yesterday told us one of the friends was removed the lymph node. Now that is called lymph node dissection. The friend had maybe stage 2 cancer, and it has spread and started affecting some of the lymph nodes. So we give chemotherapy, some drugs to start to suppress the cancer. Then we do radiotherapy. And lumpectomy means removal. So you have to start the drugs first to stop Ben, hi, and everyone. Hi sis, I see you here. I see you sister, welcome. We are continuing. Now we are at stage 2, treatment of breast cancer, stage 2. So radiotherapy comes after. You start chemotherapy, then after like 2 weeks to 1 month, according to the progress and how it has spread to the lymph nodes, you are told you will come this date to remove this breast or to remove this lump that is here. Then after you have removed the breast, you start radio. Radio is burning the cells that are there, so that they can die, not to start to progress. We burn by radio waves. Then you check the most important thing, immunoidentifiers, estrogen and progesterone. Is there any that is high? That one is a lot. Then after we do targeted therapy too. If this is high, human epidermal growth is high, we do targeted therapy. If radiotherapy, if the blood work shows that estrogen and progesterone receptor gene is high, what do? We do something that we call hormonal targeting therapy. You see, we do hormone targeted therapy. Very important. Stage 2, my friends, we have said you have the mass, it's more than 2 centimeters or 3 centimeters, and it has affected the lymph and it has affected the lymph nodes. The most important part here is to remove the mass, get the lymph nodes, do dissection to see if it is affected by the which lymph nodes are affected by the mutating cells of cancer. Then we do chemotherapy. We start 2 weeks or 1 month before removing the lump, and then we do hormonal therapy to estrogen and progesterone receptors gene, and then we do targeted therapy to human epidermal growth factor 2, if it is high. So guys, thanks for coming. If you have a question, don't just listen. This is important message. Synthesize and ask a question. It might be so important when it comes to helping of a friend or helping of a person who may suffer from breast cancer. Now, the person that was asking me about the friend was removed the lymph node. The friend that was removed the lymph node. It went for dissection. Now you know your friend was at stage 2, maybe early or late stage 2. You get? And then we have, if you have any question, my friend, you are new here. This is Benjamin the Wise Guy channel and Dr. Ben. We learn here about medical issues and some issues of importance that can help, even medical issues. So you may subscribe to the channel, like the video, and if you have any question, there is some email address there in the number that you can reach me anytime that you want. That number, when you text there, someone will get back to you, will discuss issues concerning some health issues, and you will be sorted. Don't worry where you are, even if it is where, even if it is which side of the world. We communicate with everyone everywhere. We give information and we advise. We give information and we advise. Why do you always go live with health? Why do you always go live with health issues? Simple Kate, I'm a doctor. And that is what I do good. I like people not to get to a place that they are frustrated out of knowing what to do or out of not knowing what to do. But if you want to see the other side of me, Simple Kate, join us today at 9. I don't only come here with health issues. From 4 to around 6:30 or 6, we talk about health issues. And I've seen my talks have helped and guided so many people, and I've tried to help so many people. That's why I continuously come here and talk about health issues. Health issues, you come daily, but weekends is random talk and questions. Weekends become the random talks and questions. I'm asking when do you always go live with your own? Oh, I thought you were saying why. Okay. If you are in Kenya at 4:30, I come live up to the time it ends. But at 9, it's another session. That one is another session of mental health. You can visit at 9. You see what we do. What are some of the lifestyle practices needed to fight and must be practiced to promote immune health? Mavia V has asked very important question. Avoid smoking. It brings we were in stage 2. You see, when you come, these things we had talked about in other videos, but I should, because you've asked, what do I do? I have to tell you. But if you need more thing, you can revisit the previous videos that we have done on this. So what are the causes of breast cancer? 1, smoking. 2, foods, mostly deep fried foods that have free radicals. Smoking produces free radicals that displaces the genes of your DNA, the genotype of your DNA, and then you mutate, you start having cancer. 3, genetics. Yes, Agnes Thomas, right about now you're here. Thanks a lot coming in. Your likes, if you are not liked, my friend, if you have not liked, what are you waiting for? Hit that like button, subscribe subscribe for the new people that are in subscribe. Now, the other thing is genetics. There are some hormones in the life of a person. There are some hormones in the life of a person, some genes that are called breast cancer gene 1 and breast cancer gene 2. You see, so breast cancer gene 1 helps in repairing dead DNA so that they cannot mutate to a cancer. Breast cancer gene 2, what they do, they differentiate. The differentiation is where the genes are made to do the cells are made to do their specific job that they are supposed to be doing. If it is a mammary gland cell, the epithelial cell, it is doing what it's supposed to do. You get? So if you are born with less of these genes, your family, you give birth to people that have less of these genes, you may be prone to forgiven is underrated. Hey, thank you for your teachings, daughter. Welcome, forgiven is underrated. Hit the like button, forgiven. Thank you so much. And hope you have subscribed. So some people are born with this complication because they don't have this genotype in their family, or it's less. So you are susceptible. You are prone to this. That if that body is not producing enough producer, how can you be prone to balance estrogen dominance? That is progesterone. What you are talking about here, this is called progesterone receptor gene. But when we will come to talking about progesterone, there are some drugs that are used, there are some foods that you can use. We'll talk about that, Mavia V. It's very important. You see, progesterone receptor is a gene that helps balance progesterone not to go high and not to come down. Estrogen receptor gene is a gene that balances estrogen not to go high and not to go down. Estrogen dictates how a woman looks, dictates how the breast can be big, and that's why we have the estrogen receptor at the breast level to control the breast from not producing a lot of cells that are called epithelial cells, because if they continue producing, you can have big mammary glands that are prone to cancers. So these ones are called estrogen receptor gene and progesterone receptor gene. They control, and those ones are the ones which categorize the lumina A, lumina B, high-rich and triple negative type of cancer. Let's go, my friends. Onik is saying today let's have 100. Let's have 100 likes. Bring on the people. Bring in the people. Simple Kate. Forgiven is underrated. 100% true. Thanks you a lot for those that are coming in. Please, if you have not subscribed, please subscribe, please. You know I'm saying it because one day someone will need information and you'll just tell them, I have information here on my phone. Let's ask Dr. Ben, and you'll be here to testify. So we have said it's important. Thanks forgiven is underrated. Now we continue in stage 2, in stage 3. In stage 3, no, we are in stage 2. The goal of stage 2 is cure and reduce recurrence. Stage 2, we have said I know sugar is bad because we know that from the previous live stream, but how about milk? Milk is not bad, uncle. Milk is not bad because it contains amino acids. Unless you have a problem with lactic acid. But if you don't have a problem with lactic acid, it's okay, you can use it. But don't worry yourself. After this topic, we'll talk about nutritional care on breast cancer according to staging. You get? Uncle for boosting the question. Thanks a lot. We'll talk about that according to staging. So the stage 2, we have said it is plus avoiding recurrence. Cure plus avoiding recurrence. Then we go to stage 3. Now, stage 3 is locally advanced. The breast has a mass and it is locally advanced. You see, and it's locally advanced. Large tumor If you have not followed Jamaican Uncle or any other person who is a streamer here, you can follow. Jamaican Uncle is a big YouTuber. Don't forget to do that. Large tumor, significantly lymph node involvement, may involve skin, chest wall. Now, this is stage 3, and this is where the problems are. Stage 3. This is stage 3. This is our breast. This is our breast. It has affected. Let me draw the if you have a question, you ask. This is stage 3. These are the lymph nodes. So this picture that I'm drawing, you imagine yourself that you have done a hand like this. So it is this part. So this is stage 3. Now this one, these are the axillary lymph nodes, and this one is the breast. So in stage 3, you find that it has some cells that are metastatic, and it has affected a lymph node involvement, and then it has up to the skin. You get, it has gone up to the skin here. When you look at that person's skin, it is purely orange. Have you ever looked at I used it sometimes, my coffee. Oh, okay. Have you ever looked at an orange skin? Your skin looks at an orange like that. And if you look so well at times, you will feel that it's an opening, like a wound. Now this is stage 3. The tumor is large, and I remember there is someone who told me here that he saw a wound of a person who has Marjay. That was Marjay. Marjay told us he saw a wound of a person who has breast cancer, and it was seemingly like reddish and having some veins. I said those veins, that is called angiogenesis. When it is at stage 3, the cancer cells now starts to present and produce more veins to feed them with nutrients and get more oxygen. That's when, if you have ever looked at a person who has cancer, at the wound part, you see and some more veins that are there. Yes, doctor, some red veins, yes. Because when cancer starts, it starts to know, as we mutate faster, we need oxygen and nutrients. So at stage 3, it has gone up to, you check like this and you look. Now this is a breast, but it has gone up to the lymph nodes, and there is a wound. If you look at that wound, it looks a clean wound that has veins inside with a lot of blood, because that is what cancer likes. Cancer likes nutrients so that they can metastasize, they can grow faster, and they can be bigger faster. So in stage 3, the tumor is large, significantly lymph node involvement. Lymph node, the axillary, may involve skin or chest wall. Chest wall is here. You get management here is I avoid shelf milk because of the things injected. Cow to fulfill shelf, I made on milk. Thanks for that. Now you see, so adjuvant chemotherapy first, because you cannot just go to surgery, because if you remove this breast and you have not started chemotherapy, it will advance so fast because of the open wound, and the wound will not heal. So you remove the mass, you start with chemo, you give some drugs that will stop the progression even to the lymph nodes first for like a week. Ever Blessed Travels, greetings everyone here supporting. Thanks a lot to Ever Blessed. As we continue, we are in stage 3 managing breast cancer. Please hit the like button. You are always supporting me, Ever Blessed. I thank you so much for being here, and tell your friend, good info here we relate. Now everyone who is watching, don't forget, tonight we have Feel Good Friday of mental health. Come with your playlist, if you need some more eggs, you will eat some more eggs at Feel Good Friday. There we talk of good vibes, we listen to some good music, we interact, we talk, we laugh. Mental health stability. Check out the poster on my YouTube channel, you will know what we do. Don't forget, 9 today, Kenyan time, 9 today. Find out where you are, what time 9 it will be. So we continue. That was a break. We continue. Can the doctor stop the supply of nutrients of oxygen to the cancer to grow? Yes. Sometimes it is hard because those blood supplies are connected to your body system. And that's why Jamaican uncle, the only thing that we do is to remove the mass, so that the blood supply can stop and we kill by radiotherapy and chemotherapy. That is the only way. And in stage 3, that is what we do. You start by first step, chemotherapy, non-adjuvant chemotherapy. Someone may ask something, what is non-adjuvant chemotherapy? What is non-adjuvant? Because we most of us here, you saw even my friends that we were in school with coming here. I hope you saw they were listening to me, some of my friends, yes, and they were clapping on me on WhatsApp telling me, wow, doc, you're doing good, continue feeding the public with information. If you are here and you saw them, you will know this is great information. Now, non-adjuvant means giving chemotherapy before the main treatment. Now, you have not given the main treatment, you are giving chemotherapy before the surgery. You get? So, stage 3, you give the chemotherapy before surgery, like 2 weeks before, 1 month before. Usually, in stage 3, we don't have any option. This is if you get to hospital and we see that you are in stage 3, the only thing that we can do is mastectomy, to remove the breast, because now it has advanced out, even it is affecting the lymph nodes. So we cannot continue having it. Even if you give how many chemotherapies and radiotherapies, this is a big thing and it may affect other parts of the body. So we remove the breast. It's called mastectomy. But we started by a chemotherapy non-adjuvant. Non-adjuvant means before the main treatment, you start with this. So anyone who has a question, oh, my time is still there. Anyone who has a question, don't fail to ask. I'm here. Please ask any question that you need. I'm here. Ask any question that you need. Radiotherapy after mastectomy is important to kill the cells that have mutated around the wound, so that the cancer cannot continue to spread. And then we give hormonal therapy and targeted therapy. Now, hormonal therapy is to reduce estrogen receptor gene and progesterone receptor gene, and targeted therapy is we give human epidermal growth factor 2. And you see, we said tamoxifen is one of the drugs that we can give here, and when it comes to hormonal therapy, here we give some monoclonal antibodies like trastuzumab, the ones that we were giving when people were getting COVID. You had some names like those, trastuzumab. Now, non-adjuvant, that is stage 3. The goal here is to make tumor operatable. I'm sorry to say, in stage 3, here to make the tumor operatable and control the disease locally. Treatment here is hard. And if you heal at stage 3, we thank God, and we will go to church and say, God, thank you so much for helping this person at this kind of stage to heal. So here we operate the tumor. we target to remove the tumor because of the spread. But you know, we control the disease locally. It does not say now we are in stage 3, it cannot burst somewhere else. Because you have stayed so long without going to hospital, it means that it can burst somewhere else, anywhere else in your body at stage 3. So we thank God if it doesn't burst, and we give you some continued reviews in hospital, even a year. You can be coming to the hospital for review even 1 to 2 years. Just we are checking if there is any tumor. We do the MRIs, we get the PET scans to check if there is any place that the tumor may burst. So the safest place that we usually are when it comes to staging of cancer, the safest stages, stage 0 and stage 2. Stage 0 and 2, you know, 0 is to cure, target is to cure. Stage 1, target is to cure. Stage 2, target is to cure and to avoid recurrence. Now stage 3 here, stage 3, target is to make the tumor operatable. Because if we leave the tumor there, it will go bigger. It will grow bigger and it will bring some other problems. It will grow bigger and it will bring some other problems. And we control the disease. Now, the bad stage here, the bad stage now, stage 4. The tumor has gone to, the stage 4 means the tumor has gone to the lymph nodes and now it has metastasized. It has spread even to the organs. If you go to the kidney, it's there. If you go to a bone, it is there. Here, it has spread to bone, liver, lungs, and brain. It is now the end stage of cancer. What we do here, because now we are at palliative management, here, you know, cure is impossible. Because the cancer cells are continuing to mutate to the organs. So we give systemic chemotherapy. The system, the drugs you take so that they can reduce the progression of the cancer. And we give hormonal therapy, the hormonal therapy that we have said. I know someone right now is emotional. We give those targeted therapy, trastuzumab and hormonal therapy. Tamoxifen. Tamoxifen is given to human epidermal growth factor. Good morning to how are you? Happy Friday. Grandma of 3, welcome to the platform. We are treating cancer today. Welcome to the platform. Your like and your share to someone will be invited so well. So chemotherapy we give, and then targeted therapy of trastuzumab is given. And then radiotherapy and surgery, we always control pain and bleeding, because you see the tumor that has grown means you are feeling pain because it has advanced. You have a wound and you have nerves that are involved. When you have nerves that are involved, what happens? Pain comes about. And when pain comes about, what happens? You may get high blood pressure and bleeding because the tumor is not healing, it is bleeding. So here is where we give those chemotherapy, we control pain and bleeding as we continue. Here, I'm sorry to say, let me say it, I don't like saying it. Everyone, let me say, anyone who is in the platform and you are new and you are listening to Dr. Ben and you like it and you feel that this is important information, please give a subscription. Stan's Kitchen, good day, doctor, said hi. Hi, thanks. Your like is appreciated. Please give me a like, because it will give impressions to other people to know this platform. Yes, and your subscription too. So I'm sorry to say, stage 4 has no cure. What we purpose for here at stage 4, What we purpose for is prolong life and improve quality of life. Prolong life and improve. I'm always do, my dear friend. Thanks a lot. Thanks, Kitchen. Thanks a lot. You are my friend. I acknowledge you so much. Thanks, Kitchen. And one day I want us to do a live with you while you are doing your thing. I know your kitchen is always busy. So that we give people some cooking facts and good way to cook healthy. Hey, good morning, Simple Cake. Thanks and welcome everyone that is in the platform. So we have said, I wish this video will hit 100 likes. Simple Kate, no worry. People just share the video and tell your friends that there is good information at this place. One day we will be hitting even more than 1 million. You see, happy Friday from Shah Travels. Happy Friday, Shah Travels. I'm so honored to have you here after you are live with your daughter. Me being in the background, not able to chat. Now we continue. As we have said, stage 4 has no treatment. I want to repeat the staging, and I want to repeat them so slowly so that people can know. If you didn't know about the staging, the video of yesterday we talked about staging. You can go back to the staging video and you check. Stage 1, stage 0, let's start from stage 0, is curable, and the target is prevent progression to invasive cancer. That one is to target curing and prevent the to invasive cancer. Stage 1 is the goal is to cure the cancer. Here the doctors are working to cure. Stage 1. Stage 2, the cancer here, it's your breast now, the curing and avoiding recurrence, to reduce recurrence. This is stage 2. We avoid recurrence of the breast cancer. Stage 3, the goal is to make tumor operatable and control disease locally. Is to make, you hear me right? Is to make the cancer operatable, to remove the tumor. But it doesn't say anywhere curing, no. Stage 3. But in advanced stage 4. Thank you so much, Shah Travels. Thank you so much. Stage 4. The goal is to make the tumor, reduce, prolong quality of life, improve quality of life. And you know what I want, as we go to, I want to finish with something that is nutrition according to, which is important. Foods to eat. If you have a question, this is the time now, you can ask. Nutrition according to staging. You've heard about those. There is one question that I want to leave to people, that what do you think, watching Dr. Ben at work and watching Jamaican Uncle for 24 hours. Wow, Queen CNLB. Thank you so much for that. You are really a good, nice lady. I like that. What do you think? This is a question I'm leaving to the people. What do you think? What do you think? Big up to you, host. Thanks for sharing valuable information. Here, no joke. Yes, it's no joke. What do you think, people? What do you think is the stage that takes people to hospital? What do you think is the stage that takes people to hospital? in breast cancer? Before we finish, we will analyze in breast cancer. So my question is, what stage do you think people run to hospital? It is very important. What stage do you think people run to hospital? Please, if you are here, you are new, you have not hit my like, my friend, and you think it is nice, please hit the like button. Hit the like button and share this information. Always make sure you subscribe, so that we can continue improving and even having a whole. I can even one day sponsor some people. We come to Kenya, we sit, we talk about breast cancer. You know, if I improve in life, if I grow and improve, I'll be able to sponsor my friends like Sha Travels, Queen CNLB, Barbara. You get, I tell them, Barbara, we have this seminar that we want to start. It is in Algeria, it is in Kenya, it is in Nigeria, it is in the US. I want to sponsor it. We talk live on YouTube when we are together about breast cancer. You see, so growth is important. So like and subscribe, and that time will come. That time will come. That is my prayer, that one day I'm able to sponsor 1 or 2 people here. We create that seminar, we do some big things. Many people, they don't have cancer until they start feeling unwell. Yes, but those that have cancer, what stage do you think they end up in hospital? Yes, what stage do you think they end up in hospital? No, we have talked about the treatment. You have seen how we treat cancer according to staging. But now I want to give, because I have like 30 minutes right now, and 30 minutes include even of answering your question. 30 minutes even of answering your questions. Now we have stage 0. I'm talking about what you should eat and nutritional care when it comes to breast cancer. When it comes to breast cancer, as you continue to listen, tell me, according to stage 1, 2, 3, and 4, we have 4 stages in cancer. What stage do you think people rush to hospital? What stage do you think people rush to hospital? Please tell me. Is it stage 4? Marjay B has said stage 4. Let me take a pen and a paper. So stage 1, 2, 3, 4. Once you poll, no getting back. Margaret has said 3 and 4. 3 and 4 has 1, 1. Simplicate has said 3, that is 2, 1. 3 has 2, 4 has 1. Margaret has said 4, so 4 has 2. 4 has 2. I've asked this Sha Travels, according to the staging of Marjay, you have just to tell me one stage, no, not 3 and 4. Now, according to cancer staging, stage 1, 2, 3, and 4, which stage do you think people rush to hospital? Which stage do people think, and they see, now I have to rush to hospital? So 3 has 2 people, 4 has 2 people. Let's continue polling. Sha Travel has said stage 4, so that is for stage 4 they have 3. Now, what should you eat when you are having stage 0? We have stage 0, 1, 2, 3, and 4. Oh, we have stage 0. Stage 0 is there, remember? So in stage 0, nutritional goal: prevent progression, recurrence, and support healing. Diet that you should be eating is fruits. High fruits and vegetables, they are called antioxidants. Whole grain, lean proteins, beans, fish, and chicken. Lean protein means beans, fish, and chicken, not heavy proteins like lots of greens are antioxidants. That's very true, Sha Travels. Lots of greens, they are called antioxidants. And if you have not gone through my topic on antioxidants, people confuse people out here, and they sell people things to them, telling them I'm so happy to hear the answer, and telling them that and are telling them we can sell you this product to detox your body. There is nothing like detoxing your body. Listen to that. Go and check my video on antioxidants and detoxing. The only work that the liver does is detoxing. You cannot buy something else to detox your body. Now, healthy fats like avocado, nut oils, and olive oil are important. Lean protein is important. Key nutrients like fiber reduce estrogen levels, and you know estrogen, if you have that factor in your family of breast cancer, it elevates the factor. You get? So fibers reduce estrogen levels. Vitamin D, immune support, very important, and omega-3. Avoid these things when you are at stage 0. Avoid excess sugars, processed foods, and alcohol. I don't like alcohol, so please, when you are at these stages, please avoid avoid these things. Avoid alcohol, processed foods, and sugars. A lot of sugars means that you are feeding the cancer cells, and feeding the cancer cells means more progression even to receptors like hormonal receptors like human epidermal growth factor. Trey Marie, welcome. Thanks a lot for being here. Thanks a lot. Thanks for that love. Now, that was stage 0. Stage 0. If you have any question at stage 0, ask. I'm giving nutritional care of a person who has cancer at stage 0. Stage 0, the cancer is there. There is a node that is small, less than 1 centimeters or 1.5 centimeters, and it has not progressed to the duct of the breast. It's just like a node there. So these are the foods you should eat. And then we have stage 1 to 2. Stage 1 to 2. Stage 1 to 2, patients may undergo surgery, chemotherapy, or radiotherapy. We have seen that patients may undergo surgery, chemotherapy, or radiotherapy to clear the cancer cells. You get? To clear the cancer cells. But what should you eat at these stages? Because what you eat is what dictates how your body grows. Maintain weight, support immunity, reduce treatment side effects. You reduce the treatment side effects. And how do you reduce the treatment side effects? You eat high protein diet like eggs, milk, beans, and lentil and fish. Because the cancer, this is stage 1 to 2. The cancer is creating, it is under the spell, I call it the spell, called angiogenesis. It is creating more blood vessels so faster. So if you don't have to eat protein, you will break down so faster. You will break down so faster because you need that protein for bodybuilding. So as the doctors are working on you to maintain that body, you should be giving yourself bodybuilding foods, high protein diet like egg, milk, beans, lentils, and fish. As they are preparing to remove that cancer, that tumor that is spreading, body build yourself. Energy rich foods like ugali, that is cornmeal, and rice and potatoes. Because there is, even if you don't eat, the cancer cells will break down the cholesterol that you have and the muscles that you have, so that they can control, and they can control and they have their energy and form of glucose in you. You get? Plenty of fruits and vegetables should be there. Plenty of fruits and vegetables is very important because they are antioxidants at this stage. You get? During chemotherapy, nausea is common. Small frequent meals and dry foods like toast and cracker. If mouth is so soft foods, you know, when you are undergoing chemotherapy, so many things are happening. Some targeted cells are being killed, so you may feel some nausea and so eat small frequent meals and dry foods so that if you avoid nausea. Soft foods like porridge and smashed potatoes. Important thing is you hydrate is key. 2 to 3 liters of water and fluids every day. You get raw and safe food, infection risk. You avoid raw foods and unsafe foods because of your immunity. You don't get that you don't get infections. Avoid what? Excessive fried foods. We have said you avoid excessive fried foods. And what did I say about fried foods? I said fried foods, the fat that you are frying the foods with, when it is burned, it is causing free radicals. And free radicals are the ones which displace the genes to make the cancer cells be active. So you check, avoid many free fried foods for your own benefit. So you get boiled foods are important because they help you, because they don't have free radicals. So stage 3. Stage 3, as you go on, prevent malnutrition, maintain health. You know, stage 3, we said treatment is one love, all. Bye-bye. Freddy Marie, see you at 9 when we are doing our live on. Feel free, come with your playlist of music. I'll be there to give you some touch of your music you like. Thank you so much for being here. Now, stage 3, high protein, calorie, peanut butter, eggs, and meat, like those ones. Frequent meals you should eat every time. Why? Because eating every time gives you energy. You get, if appetite is low, smoothies, milkshake, fortified porridge. Common problems in stage 3 is weight loss, fatigue, taste changes. You get, the taste in your mouth changes. And in stage 4, comfort. You give comfort. This is palliative management. Maintain strength, prevent wasting. Wasting in medicine, we call it cachexia. You have a small body, cachexia. Diet. Patient's preference is very important at stage 4, because you don't give a patient who is at stage 4 food that he or she doesn't want. He'll vomit. And you know, we are doing palliative management, improving the quality of life even if you have the disease. Patient preference is important. Soft, easy foods, high calorie foods like milk, soup, eggs, and avocados, because this is a stage whereby this patient is always having nausea, vomiting, always in hospitals and out. He should be given total attention. You get, if severe weight loss, nutritional supplements important. Do not force strict diet here. We are improving quality of life. Allow enjoyable foods that this patient wants. Sometimes you might give hormonal therapies like tamoxifen. These ones need to eat. So maintaining health is important. Avoid excessive fat intake, very important. In stage 4, you avoid excessive fat intake, because most of these patients are with tamoxifen. It may cause some adverse effects, or it may not work. If this patient you are told by the doctor he has bone metastasis, the cancer has gone to the bone, increase calcium and vitamin B. Okay? So as I finish, I need your question. I need your questions now. As I'm ending up my session on management of breast cancer. Tomorrow we will do breast cancer palliative management. As we finish breast cancer tomorrow, we will do palliative management. So stage 0 is prevention. Stage 1 to 2 is supportive treatment. Stage 3 is preventing wasting. Stage 4, comfort and quality of life, palliative management. So palliative management is a big topic. We will do it tomorrow. If we don't finish, we'll do it on Sunday or Monday. So any question from anyone concerning our topic today? And remember guys, feel good Friday today. Feel good Friday today. When you come there, you come with your playlist. Come with your playlist that we will hit them songs there, and we feel good. Today at 9 Kenyan time. At 9. Anyone with any question, my friends? Anyone with any question? Anyone who has a question? Anyone who has not subscribed? Yeah. Thanks for the information of cancer, Dr. Ben. Thanks a lot, Share Travels, for tuning in. Anyone who has not subscribed or liked? Nice one. I think everyone is okay. Let me give like 2 minutes or 3 so that maybe someone is typing. Someone is typing on a question and that person may want to ask a question. Yes. Anyone who has a question, it's important to ask. Don't fail to ask questions. Whatever you are thinking you should ask, someone else is also asking, should I ask? So when you ask, watching from work, as you know, yes, I know you are at work and you're watching. So when you ask, what happens? That other person starts to ask the other questions that had. But it's okay. I thank everyone who has been here. As we want to, I have to go to Jamaican's Uncle Premier today to check out Jamaican's Uncle. That is at 7 Kenyan time. So if you'll be at 7 Kenyan time, you can check out Jamaican Uncle and what he's doing there. He's a good big YouTuber. I call him the Empire. Please check out Jamaican Uncle. It will be there at 7. 1 hour from now, Jamaican Uncle will be premiering. And then at 9, my friend, at 9 is where we lose ourselves. We take it to the other level. You see Dr. Ben, the other side. But it's a mental health program. Yes, a mental health program. So if you have issues concerning mental health, that is the space you should be joining at 9 today. Anyone that has not subscribed, to everyone, big up Share Travels, big up Simplicate, big up Jamaican Uncle, the Emperor himself, big up everyone, Terry Marie, she has just left, Majay B, Margaret in Norway, Quincy NLB, Ever Blessed Travels, everyone that you've been here, Stan's Kitchen, at 9 p.m. Yes, 1 hour from now, 6, 7, 8, 9. 2 hours from now. 6, 7, 8, 9. 2 hours from now, we will be doing that. We will be doing our Feel Good Friday. Come with your best music playlist. Drop it to the chat and we'll see what I can do with it. And we can see Margaret in Noiril, always my sister. I thank you for every support you are giving and every support we are doing as a team. Forgiven is underrated. Thank you so much for the subscription. Everyone, Barbara, my friend from Uganda, everyone that has been here, I say thank you. See you at night as I give you the good vibes of mental health through reggae music and all the music that you want to feel and feel good as we talk about mental health. Bye. See you then. See you everyone.